We're live? Okay. All right.
Great. All right,
I
are we ready? Yes,
Or would you like to go ahead?
that'd be great.
Okay.
That'd be great.
Okay. All right, perfect. I did not include the minutes in the handout, so unfortunately that will have to be postponed until the next meeting. I'll provide an overview regarding the priorities. This was included in your packet. There are 5 priority areas. The first one is to address public health hazards to protect the community. This really looks at mass care preparedness, which is a notable gap in our community. Public health, we have a minimal role in this. However, due to the implications to the community, this is an area that we want to provide services to the community on, specifically support to the municipalities. So this was one of the focus areas identified on the preparedness side. Also, with cybersecurity becoming an ever important requirement, this was another focus area, especially with House Bill 90, but also just with general business continuity preparedness, we wanted to focus our efforts towards that end. And also with that end, general business continuity, due to concerns relevant to fiscal situations with the agency, we want to make sure that we are prepared for that eventuality if it were to occur. The second topic is to strengthen community conditions, access to care, and health equity. So the focus areas associated with this was to look at stopgap services relevant to public health programming that we provide here. We want to make sure that our services are targeted to address any potential needs in our community that's not being met by other providers. We want to make sure that we are that stopgap force. Strengthen our behavioral health strategies and our community support. So really looking at our community trauma, substance use, and our services specifically around behavioral health. Environmental health and community health protections. So really looking at the services provided by our environmental health program and our community health programs to make sure that we are meeting the needs of the community, specifically to evolving threats such as lead, vector hazards such as tick-borne concerns. So making sure that we are addressing the current demands as they present itself in our community. And also maintaining a good pulse relevant to the status of the county to make sure that our services are addressing those needs and to making sure that they are having a direct impact on the public. It is a viable service and it is resulting in positive change. The next topic looks at modernizing public health practices through quality improvement, data innovation, and interoperability. This is similar to one that we had in the past, although we did some slight revisions within the strategic plan for priority on these topics. Quality improvement is always a central element that we've had in our previous strategic plans. We want to make sure that we are tasking ourselves to make sure that our services are provided in its utmost efficiency and that we mitigate any potential delays or challenges that would impact service. Public health data systems and analytics. So really looking at the informatics side of the house to make sure that our systems are interoperable. They are providing good information to us and other stakeholders in our decision-making process. That, I believe, was in the past one, but one that we still found essential to continue. Evaluation, performance management, and program accountability. So this really looks at evaluating our programs and services that are being performed to make sure that they are truly creating positive change within the community. And if there's any type of changes that need to occur, we can look at identifying those. Performance management to make sure that we are meeting the objectives of these programs and we're actually moving the ball forward within our community. And we have measures within our staff to measure ourselves to make sure that that is progressing. It's really holding us accountable to the expected service that we have. And this would include an evaluation of our programs across the board to make sure that we are meeting those requirements. The Qualified Health Information Network, that's looking at establishing a information exchange with healthcare stakeholders within our community. This was one of the benefits that we saw during COVID when we collaborated significantly, but we wanted to make sure that this can expand. And this is an initiative that we have sought, and we actually have talked to the Trailhead Foundation about this as well, advocating for this to be a potential topic that they could look into to benefit the bigger region as well, to help with that information exchange. So we'll improve our data sets and really improve an understanding of the needs of our community. The other aspect of this is responsible use of artificial intelligence and embracing emerging technology. AOHC recently did a survey of health departments to evaluate how much they are using artificial intelligence. and looking at training opportunities to expand public health and how we potentially could use this evolving technology to public health benefit. So we want to embrace that and explore the possibilities here within Summit County Public Health. The next topic, this was maintained, this was in the previous one as well, was to foster employee engagement, development, and performance. So the first one is looking at workforce development and skill building, so making sure our workforce is trained and we have a training platform that expands our skill set and knowledge as we move up through the organizations or take on new programming to make sure we have a structured process in place. Cross-program awareness and integration. This was identified as a weakness in our SWOT assessment. We're looking at different modalities to improve awareness to programming across the agency to make sure that different services could be interoperable. If we can have that option in place for some services that may be looking at doing an additional service to the community, there's additional requests and making sure that we can connect all the dots appropriately to better serve our clientele with other services that we offer. Leadership, supervision, and management development. This is really looking at developing a standard training platform for program coordinators and supervisors as they move through the organization, that they come in and learn a foundational training platform, learn foundational skill sets that's needed for them to perform their position. I think we do a very good job on the technical side when employees take on different responsibilities within programs. However, there's a little bit of a gap in training and education to personnel as they move throughout the organization. So this is really looking at refining that, and this is a task for human resources to look at, is to develop common training content as individuals move throughout the organization. The next one is develop and advocate for evidence-based policy, practices, and programs. So this is looking at really just utilizing community data and assessments and policy practices to better inform decision-making, the use of data and how we utilize that, and really the trusted public health communication engagement. The trusted communication engagement was a dedicated priority topic in the last strategic plan, but it's really looking at gaining our credibility back or maintaining the credibility that we have within the community. We want to make sure that that's a focus point. This was a carryover from the last one. And the last one is strengthen financial stability and fiscal stewardship. So this is really just strengthening our capability to maintain a good pulse on our fiscal position here within the organization. It's really focused on long-term financial planning and stability, looking at that business continuity component to fiscal management, and really do some financial resource and strategic planning around potential challenges that we may encounter. I know in the past we've talked about potential grant funding cuts, the property tax issue that we have. This is really focusing on those topics and looking at long-term strategic plans in case any of those scenarios unfold. That's an overview of the strategic priorities. Dr. Cook, I don't know if you have anything else to add.
No, I think you did an excellent job. Thank you.
Okay, thank you. The next topic is the timeline. You have a copy of this in your handouts. This is really just a breakdown of the timeline. We are actually ahead of schedule right now. So this is really the overview of the goals and objectives by the divisions. That was the main tasking. At this point, we'll be moving into development of the template with our vendor, but also importing the goals and objectives into our Cascade system, which we use to track our goals and objectives as we move throughout the years. Anything else you want to add to that, Steve?
Nope, I think you got it.
No,
we'll do additional things. Oh, sorry.
Oh, go ahead, Dr. Cook.
Oh, no, I said I didn't have anything to add. Sorry.
Okay.
The only thing that I'll add is that we do a retraining of Cascade for all of our staff, so they know how to find it, so that it's easy, accessible, and like where to find our reports. So we'll put that out in the news.
Oh, nice.
All right, thank you.
Nice.
So the next part of the agenda is to go over the division goals. This draft is also provided in your handouts and electronically available. This is really in draft format. Let me make sure I got the right one up, this one. So this is what we provide to the company that we will use to actually generate the formal printed document that we will send to publication. So this is just draft, but this really gives a good summary of what we traditionally develop. So I'm going to ask each director to go through, starting with the Office of the Health Commissioner, and that's Corey.
Yeah, try to go over high level. If you guys have more questions, please let me know. I did note on here we accidentally duplicated goal 2 and 3, or it might have been 3 and 4, and so they're on your copy, it's the same thing. So I'll kind of just talk a little bit about that. So for behavioral health, we've been, knock on wood, fortunate for level funding and actually increased funding over the last several years, seeking out new opportunities. First goal is really internally, how do we make all of our staff and programs aware of all the opportunities we have available internally? And a good example of some success of that is working with clinical health and communicable disease with the HIV and hepatitis C overlap. But how do we also just do that with each and every program in the agency, look for opportunities, because everyone has been impacted in some way by mental health or substance use, and so how can we strengthen connection for those individuals through different programs and pathways? That's goal 1. Goal 2, I announced a few meetings ago that we obtained our national accreditation for behavioral health, which allowed us to get our OMAS certification for treatment, which is exciting. And so we saw a gap in the community. We were able to apply for a grant, received it, and actually starting tomorrow, we'll be offering low barrier MAT services within our syringe service program.
Nice.
Something that hasn't been available really only through the hospital system for same day. With that though, there's some extra steps with that strategic plan. We need to then get we have our inaugural accreditation, we have to get our 3-year accreditation. And then this also allows us to look for sustainability with other things with this. So not just treatment, but peer services, case management, and looking at a long-term sustainability goal, how do we build in sustainability? So now Medicaid billing and where are those opportunities? I have the giant Medicaid billing book on my desk, and that would be the next step. How do we become billable in the event that we do lose funding? We can supplement some of those resources and still continue to offer what we do every day. Third, expanding services. This is one that's kind of duplicated and missing for harm reduction, suicide prevention, trauma-informed care, and recovery-friendly resources in workplace. So we were awarded at County Council last week contracts for the county-wide trauma-informed care initiative. So we'll be leading that initiative along with funding through the ADM board. We anticipate having enough funding to come to a position dedicated to trauma-informed care, recovery from the workplace, for at least the 3-year strategic plan cycle. And so how do we improve that? And there's a lot of good ideas the staff had for our strategic plan for objectives and KPIs to track that. And then finally, just looking internally, how do we provide better customer service? How do we reduce barriers? There's a quality improvement project in goal 4 to really working with the people we serve and improving our processes and services. Epidemiology and informatics. Chris hit on a lot of this with his sort of presentation on, how do we integrate these services together to better inform the work that we do. So a lot of the goals within that is to improve the services, to streamline, there's quality improvement built into there. How do we increase our internal utilization of our epidemiology and informatics, and also externally? And since combining those units underneath the same division, we've seen some really great progress in how we're able to merge the two and get fast real-time information, reduce manual labor, and kind of blend the two with epidemiology and informatics. But with the informatics and the programming work they're doing, we're building more and more things, making programs more and more efficient, but that also creates risk because if people that build those systems are sick or decide to move on, we have to have redundancy. So trying to build that redundancy, that cross-training within that division, and doing things like code checking and things like that so that everyone understands where everyone's at in different projects. We're not siloing any of our different projects. Information technology, so sort of the infrastructure. Cybersecurity has been a huge topic with the new House bill that passed. We passed our internal policies we're required to do by Ohio Revised Code, but we have a lot of work to do throughout the strategic planning cycle for trainings, policies, tabletop exercises, improving hardware and software, and cross-training. Every day we see, almost every week, a new threat that comes through. They're getting extremely sophisticated, and a lot of our partner organizations are being attacked, targeted, and infiltrated. Knock on wood, we have not yet, but it's only you know, a matter of time. So we have to keep our defenses strong, and this is a strong focus in this area. And then finally, for quality of life, this is our major sort of plans and programs that we have in the agency. So this is looking at how do we continue to increase our collaboration with community partners for such things as the community health assessment, community health improvement plan, youth risk behavior survey, which may be some challenges this next cycle around to work with the school systems and getting them implemented, and then also quality improvement to enhance some of that other related work we do with the fatality review boards. And then finally, the policy work that we do with the policy subcommittee in the community, and then how do we look at, you know, sort of small P policy and what sort of things can we use our coalition efforts and community partnerships to move some of those policy agenda items across in the community. And that is as far as I can make it, and if you have any questions.
I do have one question, just because I've seen this more and more. Do you, and I think the answer is no, but I want to ask the question. Are you currently using any AI right now to help with your cybersecurity systems? I mean, I've seen a couple hospital systems start to tap into using AI to try to mitigate some of these cybersecurity threats.
I don't know we are directly. Some of the vendors we use may be using it in their systems when they're alerting us of suspicious activities. But Jason, do you know of any of our vendors that are utilizing AI?
We have CrowdStrike as our leading antivirus, and they're very aware of everything going on. We use AI exactly.
I was just curious.
We do get vulnerability alerts and real-time awareness from these vendors that we've contracted with. Whether they're using AI, I imagine they probably are, but I don't know 100%.
My question was going to be, are you using AI anywhere, not just with cybersecurity?
Yes, we created an AI policy about 6 months ago or so, and we are using, so we are a Google Enterprise shop, and so Google Gemini is incorporated within our organization. So we put together policies and guidelines on how to use that. There's also an approval process for new AI to be used, but our only HIPAA tiered AI technology is through the Gemini product through Google. And Steve's done a lot of work with that, and he's made some amazing breakthroughs on such things as like scanning and OCR and other things that we can utilize to efficiencies.
And if you've never used Google Gemini, I encourage you to. I think it's amazing. I'm sure you know that already, but I use it for my talking points.
Yeah.
I use it at work all the time. So quick, efficient, and it's typically very on target.
My comment is not necessarily for you, but for Angela. So I'm in a public audit, and you know, the auditor's office is finally looking at the computer, you know, all your cybersecurity stuff. There are young people they hired whose only job, and it's like separated from the audit.
Yep.
It's like just an audit on that.
Mm-hmm.
And so I'll debrief you because we're like 2 people that I run the town cemetery, the towns up there. And I just do the books and records. And I felt like, oh my gosh, like it's kind of crazy how much they were asking me
Mm-hmm.
for, you know, so you're going to get like an entire audit on it. So just all your backups, where they all are, how they all are, what are all the, it's just incredible. So
I had more requests for the IT side of our fiscal audit this year than I did for the actual.
The whole packet for the auditor state we had to complete for IT side of the audit,
yeah, but I think it's become much more sophisticated.
Oh, yeah.
Like it is like in the last 6 months, I mean, it's just insane how many questions and how much information you have to provide.
Mm-hmm.
It's almost its own audit.
It is.
Very bad. I mean, it's good, but it's also.
We're expecting it to continue to increase and know with that House bill that there's requirements.
And Chris, thanks for the handouts. I was looking at last
They were out.
I know. I was like, sorry.
I thought.
I'm up on my way in.
I mean, I already had one, so I'm looking through it.
I can't remember all those.
I thought they were distributed, sorry.
And I was looking for that.
Yes,
We
Jeff,
were
they
all
were
very bashful of like, I don't think we have
Well, you
this
said your
in
hand
our
out.
hand.
So it's like, well,
So sorry. So Corey, you walk out from this, because we were still scrambling. We're looking at the old.
Yeah.
Yeah, I thought the copies were disseminated early before board, so I apologize.
Fine. When we were too bashful to say, I don't think I have this.
I mean, and I
Maybe
have
I'm
it. I'm sitting here with-
I'm looking at my email, and I'm like, I don't.
Was I supposed to print something before I came
I couldn't
down?
find it, but I remember talking about this.
Yes,
So there's
yeah.
no problem. I mean, I understand.
Mhm.
Great, thank you.
Okay.
Thank you.
Great. Angela?
Sure, so I've got operations and general support services. The major focus for our support services goals this year and objectives are basically modernization and process improvements for stakeholders and end users. Going through to start with birth and death records or vital statistics. Our first goal is to improve access to Summit County birth and death records by using modernization on our record systems, expanding digital access for the public. We are looking into digitizing our legacy birth and death records that are currently stored on microfilm, and to be able to preserve those records and to have efficiency in retrieval of those records, as well as creating a portal online to assist the public with genealogy research. So there are there's a limited amount of information that is public record that we could allow people to research from our website online, and able to do their genealogy research that would also streamline operations for our staff, so they would not have to answer the request if people can get that information on their own. Strengthen program resilience and continuity of operations by building staff capacity, standardizing processes, improving operational readiness, assess current vital statistic processes, identify opportunities for improvement based upon internal and external stakeholder feedback, ensuring all program staff are cross-trained in all procedures, and creating a centralized document repository to house department SOPs. Moving on to emergency preparedness. First goal, strengthen emergency preparedness response capability by enhancing mass care and medical countermeasure planning, coordination, and operational readiness. So the goal here is to collaborate with local stakeholders, spearheading the creation of a unified mass care plan for at least one municipality in our county, identifying staffing roles and resource requirements in order to sort of spearhead an initial plan for mass care response. Update the medical countermeasure dispensing plan, include a detailed scalable plan for multiple ranges of response, and then also conducting exercises to test these plans. Goal number 2, strengthen organizational resilience by improving the management of response and enhancing continuity of operations capabilities to ensure the delivery of mission essential public health services during disruption. Okay, today. So basically implementing a centralized digital asset management system to track all of the assets that we currently have in our emergency preparedness program, including automated alerts for maintenance and expiration dates, also allowing us the ability to other municipalities and agencies to access our resources to see what we have available for those communities for sharing. Also to complete a comprehensive revision of the continuity of operations plan, and also conduct an activation drill on that plan to basically to involve the staff at all levels so they understand what the COOP is and what the response requirements are for that. Next, we have fiscal operations. So empower the focus is education and improving experience for the end users and our stakeholders, which are program staff and employees. So we are looking at empowering members of the organization with a comprehensive understanding and practical skills related to fiscal processes, fostering a culture of financial literacy and accountability. So the goals are to develop and implement fiscal training for program staff, standardizing communication using similar terminology or understandable terminology, and increasing communication with program staff, as well as creating a centralized document repository, allowing staff to efficiently locate materials that they may need in their day-to-day work that maybe they're now having to reach out to physical staff to obtain. Second, strengthen financial sustainability and fiscal stewardship by aligning financial resources with public health priorities, enhancing accountability, and supporting long-term organizational stability. So this is just, as Chris was alluding to earlier, creating a long-term financial planning framework that we can use to assess different funding trends, track potential risks, and identify sustainability solutions, so that at any point in time, if we have any kind of major initiatives or concerns, we are able to access and kind of do a projection out of how those will affect the agency over a long-term study. And then develop and execute fiscal quality improvement projects to prioritize inclusivity and aim to improve processes and outcomes across the organization. We've had excellent momentum and response from multiple QI projects that we've implemented over the last year or two with the help of Steve and his group. Just basically streamlining processes, workflows, creating electronic workflows that were prior paper processes. So we want to just kind of move with that momentum to assess more of our fiscal processes in the agency, other things we can create these electronic workflows and increase the user experience, I guess, while streamlining and allowing for things to get done a little quicker. I do think the time improvement and the lift of the staff has improved tremendously. We had excellent feedback from our electronic purchase order process, our electronic travel request process. So those are kudos to Steve and his staff for that as well. For human resources, create and maintain a highly qualified, professional, diverse, and responsive workforce that accurately reflects the population of Summit County. So our focus continues to be employee recruitment, retention, and engagement. Our focus in the previous strategic plan was heavily on recruiting and filling vacant positions that we were struggling with filling in the past. We have expanded our footprint on how we post our job positions, where we recruit at. We've created some really good relationships with the universities in the area. We attend the job fairs all around the area in order to just kind of give an overview of public health employment, what the types of jobs are here. So now that we're getting the candidates coming in, we definitely have increased our number of candidates in our postings when we put them out. Now we're going to focus on moving towards staff development, creating those development work plans for staff moving through management, training new supervisors in those basic management skills, establishing job-specific training tracks for core roles, identifying succession planning for future staffing needs, and including cross-departmental mentorship. So I think staff are really interested in having building those relationships across divisions as far as mentoring and having support throughout the agency. Goal number 2 for HR is identify, digitize, and optimize manual HR workflows and tracking mechanisms. Again, we're looking at creating those modernizing our processes, creating digital workflows, and basically standardizing anything we're doing now that's more antiquated, moving it into a more digital platform and allowing it to be more accessible to the HR team for anyone at any point in time to be able to do any work that needs to be done. Design and maintain a comprehensive total rewards program that ensures market competitiveness and a holistic approach to employee well-being. So that is, within that, we want to conduct a comprehensive compensation and classification study to ensure we're being competitive in our fields, provide staff personal financial wellness education opportunities, and evaluate opportunities for potential supplemental wellness maybe discount programs or whatnot to encourage staff and their personal wellness. And then fourth goal for HR is the workforce development plan. The workforce development plan is an accreditation requirement, and that plan serves as a blueprint for our agency staffing needs, staff development, education, training, and employee satisfaction. The plan coincides with the timeline of the agency's strategic plan. So when a new strategic plan is being built and established, we are also working on the new workforce development plan. One more for me, public information communication. The primary focus for public information and communication is process and platform modernization. Again, it's the same kind of, same theme throughout all of support services. Our one main goal is to develop and implement a functional health alerts network platform. So the goal is to update and utilize contract management software with a focus on maintaining up-to-date resource information for use with time-sensitive information dissemination. That is a major focus for us in this next strategic plan. Improve efficiency, accessibility, and responsiveness of marketing services. So our public information and communication team leads the marketing processes for the agency, and so they do a lot of marketing work with the other programs to help them create the any kind of types of information they need to disseminate out to the public, whether it be brochures, social media posting, anything that's billboards, anything like that. So the goal is to improve those responses and redesign our marketing request process, just in order to make it a better more user-friendly service for staff. We've got modernize the digital presence and brand identity. So we're looking at a full redesign and upgrade of our agency website over the next year and a half. This is a necessary, we have to do this because of ADA, so there's federal ADA compliance for digital accessibility. The current website we have is aging out. The platform is aging out, and the current platform limits the ability that our internal staff have to make edits and adjustments to our current website. So we are going to be looking for something, a different platform that we can have created and that will be able to be maintained in-house by our marketing staff instead of having to go out for someone else to update our website content for us. I think that is everything. And if you have any questions, I'd be happy to answer any. A lot of information.
Late hour, but just one suggestion.
Yes.
Birth and death. We can do anything in Ohio, all birth and death. That's kind of new.
That's correct, yes. So
Has that been, like, is there going to be a movement for the state to take it all over? Because you can get the state system, you can go down there and order anything you want, but I typically try to do that. And like, to talk to Tavia or something with the title registration, because like they're up north, but the Cuyahoga doesn't do a great job. So a lot of people from the north, all the car dealers, drive down to Northville to do their title work because it's so much easier. You might become a hub. Does that make sense? If you made it so, because your website's easy, it's so easy to do that.
we have a lot of Cuyahoga County funeral homes already that come to us for service now that we can issue death certificates across the state.
Yeah, because it's like, it's a bad system up there, and like, if you wanted to go to Cleveland to get one, you might as well just forget it.
Yeah.
Like, now you can go here. I don't know how you market that, but I think you
Wanda
guys
does
could-
an awesome job of marketing us
Yeah.
for, across the state. She reaches out, she's a part of the Funeral Directors Association, so she reaches out to them on like a listserv, sends out updates to them. We have everything available online. The funeral directors can pre-order.
Yeah.
So they can place an order with us online, come down, pick up, and then pay at the time of pickup, and we have everything ready for them, so.
Okay, great.
We're
I know
definitely
she's on top of it.
selling
I'm
that.
just saying, there's like a huge marketing thing, but is the state ever gonna really take that? Because, you know, you can order everything through them.
They send them to us.
Oh. So when you order from them, it really comes to you? That's why it takes 3 weeks or whatever, because whatever they do. Okay, thanks. Very interesting. Maybe, if funeral directors, that's where it's at. Who else needs birth records? Schools?
So we
Maybe
do
all
have-
the schools
yeah.
now, hey, just call these people, they'll get you a birth.
We put all of our information out. We have kiosks in the hospitals, in the Summit County hospitals, so that new parents can order their birth certificates before they leave the hospital. And then once the birth certificate is registered with us, then we mail it out to them.
Okay, very impressive.
Get fewer babies in the,
Huh?
we get fewer babies in the lobby, but nice
Yes,
service.
that's true.
Yeah, but it's really a nice service. I'm glad you're getting Cuyahoga, because, it's bad up there.
Sonia?
So environmental health is divided into 5 units. So for the most part, the priorities that we address are the modernization of public health and strengthening community conditions. We did have a couple that addressed public health hazards and fostering employee engagement, but for the most part, the first 2 that I mentioned are the primary places where we focus. So in the air quality and solid waste unit, they have a goal of increasing community awareness of their programming. The air division has a little bit of an issue with people knowing who they are and what they do. So a lot of their focus wants to be to help their branding and their name recognition. And they want to also maintain their equipment. They have a lot of equipment in air quality, and they're trying to modernize some of their tracking of that equipment. So, and to make it a little bit more accessible. And there's a lot of maintenance on this equipment. So a lot of that has to be tracked, and they're going to be working on some data configuration for that. Moving on to, we have an administration unit, which is basically our billing and our clerk that process all of our applications and things like that. In that unit, they are going to be working on strengthening their administrative capacity and cross-training. A lot of the ladies that work in administration have been here for a really long time, and they do a very specific job. So our goal is to make sure that everyone can do the job of everyone else. And in addition to that, the reason why it's so important in this strategic plan is we just adopted a new health space cloud-based system, which we run all of our licenses and our billing through. So right now, the training on that, we're still in, we adopted it in May. So the training on it is really limited to a few people because we're still figuring it out, but the idea would be to get everybody up to speed on that. And then also to make sure that they have the SOPs that we just wrote have to be rewritten for our new system. So that's going to take a bulk of the time to get that one in order. Goal number 2 is to improve the efficiency, accessibility, and reliability of our communication systems through a standardized operational directory, which is the one that I sort of just mentioned, where we just want to make sure that we have everything in order so that anyone can do anyone else's job in that unit. The thing is, we move millions of dollars through environmental health every year, and there are audit sheets and things on the back end in fiscal that have to reconcile. So the more we can make that standardized and centralized, the better we're going to be able to do that. In food safety and recreation, their goals are surrounding the quality of food safety inspections and complaint investigations. We do have quite a few new staff in this unit. I think 2026 is probably the first year that we haven't had to hire multiple staff into food safety. So everybody that works in that unit has at least a year of experience, which is, you know, it's giving them a little bit of, comfort in their training protocol, but we can't get too comfortable in that. So, some of their goals have to do with just making sure that we have the quality of inspections from every individual team member and making sure that, we adhere to timelines regarding complaint investigations and things of that nature. The second goal is more of a positive sort of goal. It's a clean kitchen award that the staff would like to work on. That is something across the state of Ohio that there are multiple jurisdictions that do something like that. There are models out there we would like to use bits and pieces from for our award. And it would be a voluntary program, so people would self-nominate on that. And as long as they meet the criteria, then they would receive the award. Some of the models out there don't quite work that way. It relies on nominations. So the one that we're proposing is going to be more of a self-led sort of program. So they can go for the award if they feel that they need it, and if they meet the criteria, then they would receive it. And then we would like to increase operator participation in our food safety basics training program. So this one has popped in and off, on and off of our strategic plan for several years. We've tried different ways of engaging restaurant workers with food safety basics, which is required for operation. So some of the goals that they have for this year is maybe having like an online class, or having different languages, which we have done in the past, so expansion on that food safety basics. And then in our Healthy Homes unit, which does include the lead program, that one is really robust for this year because we are just getting our lead grant up and moving. But the first goal is to prevent vector-borne disease, and Dr. S. kind of talked about this a little bit with the increase in Lyme disease that we're seeing. And a lot of our vector control programming has to do with mosquito-borne illness, which we actually really don't see much of in Summit County or the state any longer. Our West Nile cases are down from where they were in the early 2000s, but they've been replaced with tick-borne disease. So ticks are a little more difficult to control in the environment, but there are some strategies that can be used, which we're going to try to implement for just making people aware of the dangers of ticks and what to do if you find one on your body. And then for goal 2, we have animal bite reporting requirements. So we have identified a weakness in our veterinary clinic staff. A lot of times they will submit an animal for testing to the state, and they don't really notify us about that. And a lot of times that animal has been involved in a bite. So they are mandatory reporters. So we're going to do some outreach with our veterinary clinics to make sure they understand what their requirements are as veterinarians when they receive information about an animal bite. So the next 3, I believe, are lead related. So there is a questionnaire that has to be completed whenever we do a lead investigation. And the goal 3 is around improving the completion rates of that and making sure that we can help prevent lead-related health outcomes. So the easiest ways to do that usually are with outreach, and sometimes it's really difficult to get a hold of these families. So that strategy is kind of looking at what we can do to make those rates of the questionnaire that's required to be filled out to be increased. And then the city of Akron also has a HUD lead grant, which we have one here, and the city of Boston has one. And for years, we've tried to coordinate with the city of Akron to maybe perhaps do a joint lead application. But every time we've approached that topic in the past, always kind of been too late. It's usually like right when the lead grant is running out, and everyone's like, well, we're just going to do our own application. Well, the goal for this strategic plan would be to start some of those conversations with the city of Akron on maybe looking at putting these programs together, because it makes sense HUD has actually mentioned to us multiple times that they would like to see us go with the joint application since we are the same jurisdiction. It can be very confusing for people who utilize the lead grant. They don't even realize where they applied because the applications are basically the same, but go to two different jurisdictions. A lot of times we will get the applications for Akron and we have to send it over to them or vice versa. So those would be some more higher level conversations on the future of the lead program in Summit County. And then the last one for them is to increase the cross-training knowledgeability of staff. Again, that program has seen some turnover with staffing, and we have some newer staff in there that need some cross-training. In general, in that unit, we have people that are kind of like that. They do the housing, and then we have people that do the lead, but we need to cross those a little bit so we could get some flexibility. Last but not least, our water quality unit. We're going to be talking with you guys, hopefully, in the next year or so about a blanket variance process for STS, that's the sewage treatment system program. We're getting an awful lot of variances, and Jeff will attest to the fact that we, you know, it seems like we have one or two every other month. So years ago, we put a blanket variance into place for our private water system. And it's cut down. We don't really get well variances. So as long as we can all agree on some criteria that the board would be willing to say is a blank, it would be fit into the criteria of a blanket variance. And that's something that we would like to look at. Of course, there are always going to be special circumstances. Not everybody fits into that. And then the last one has to do with improving accessibility and the ability to use the resources that we have on the website. The water quality website is pretty large. So it kind of goes hand in hand with what Angela was saying about the redo on our website. So that's it.
Any questions?
I think the blanket variance process is a really good idea.
Me too.
Because
Hoping you guys would.
we do, I mean, because a lot of them are very similar.
Yeah, they're pretty rote, you know, I mean, the ones that would be more complex would not fit into.
Right, of course.
I don't have a question, but just a comment since you covered solid waste as part of this. Being from Barberton, there's a lot of rentals in Barberton, and, you know, there's a lot of mudslinging going in Barberton right now. So whenever there's a problem, everything shows up on Facebook. So I've been looking at some of the Barberton sites, and with rentals and all the rain we've been having, there's been a lot of basement backups. And I was surprised. I don't know why it took me by surprise, but like about every third comment was call the health department. Somebody, you know, and then another comment, call the health department, comment, call the health department. I thought, oh, call the health department. You know what I mean, as far as solid waste goes, and there's like a lot of these, there's children or a baby in the house and, you know, slum landlords. And I was surprised. I mean, I don't know why, or just it really made me more aware than I had ever thought to be. But somebody mentioned they had worked with the Keith that works here and got like rave reviews. Call Keith. He came right out and he got the ball rolling. I didn't bring my phone in because I didn't want to start ringing like I did on my first meeting here. So I left it in the car, but just a snapshot of this gentleman's name. But I think it was Keith, and they implied he was from the health department. So, but anyways, I mean, but, you know, they were like.
We don't have a Keith.
Okay.
That doesn't mean that it's not one of our folks, but a lot of times people get the health department in the city of Barberton.
Well, but see, we don't have a health department, we have a health
Yeah,
board.
but they're calling, they call the city and they're gonna get like zoning, or like what Barry used to do. And you know, the city services are coming out and they think it's the health department or vice versa.
Okay, because they're saying call the health department.
Yeah,
I thought, well,
they do call us.
They have a health department, so it must be calling
Yeah.
some county, but I'm not even sure how many people are aware that Barberton doesn't have a health department, that they are under Summit County.
Yeah.
You know what I mean? 'Cause I don't know.
I mean, every city, village, and township kind of has a different configuration, so depending for services. So, you know, in Barberton, they do have a housing code, and they do have pretty robust code enforcement.
Okay.
So, you know.
Mr. John, okay, because I was
Yeah,
gonna say, I mean,
it's
kudos
very
to
well
him
staffed.
through the health department if he is an employee here, that he's
Yeah.
very responsive evidently, because
Yeah.
he's the guy to call. Hire him.
I love the clean kitchen.
Oh.
We only read about them. places.
Yeah, that's what we
And it's
were-
nice to have that, but I think we need to also think about regulating. If you advertise with that information, you have to advertise the year that
Oh,
you won
correct.
the award.
Yes.
So that if you become the dirty kitchen.
Right.
And
You know what I
it
mean?
doesn't
Or
roll
we
over.
take it away. You know what I mean?
Yeah.
That they do that, but it's a great idea, because all we do is read about the places we don't want.
Well, and the idea kind of came from the dirty dining that, the Beacon does, so it's the flip side of that.
Right, they would do the dirty
Yeah.
and the clean.
And we did an article, there's an article in the Beacon a few months back, where they went out with an inspector to kind of see what happens on an inspection. And, you know, the reporter was kind of impressed that, you know, that it looks as good as, you know, it looks pretty good out there. So, you know, in a normal kitchen, not one that makes the list. So, we thought we need to give some recognition for.
It's perfect, but regulate how that they have to put the year they want it, so that they don't like
Yeah.
become dirty and then.
I think they have a whole stickering system and thing in mind and all that kind of thing they can put on their door, like a clean sticker or that kind of thing.
It's a great idea. Perfect.
All right, thank you. Joanne?
Clinical health has 3 strategic planning units, and almost all of them fall into the first 3 prioritization categories: addressing public health hazards, strengthening community conditions and access to care, modernizing public health practice through QI, and then we also have one for fostering employee engagement. Before I go through each of the goals for different units, I just want to emphasize, and everybody else did this too, I know, but these goals came directly out of conversations that were held with staff. We had staff meetings in all these units. They determined what the strengths, weaknesses, opportunities, and threats were for their unit in their mind's eye. And of course, we had discussion afterwards to kind of come up with these. So I'll say that before I go on to the goals. And again, the other thing is keep in mind that a lot of what clinical health does is it's per code. The things that we do are per code. We don't get to have a lot of imagination in this particular area of the health department, and that's okay, but I just like to say that out loud. In clinic, the first goal is to improve access to and utilization of clinical services by increasing public awareness. This was definitely brought up by staff. They feel like the community a lot of times doesn't know that we exist, and I understand that. We're very limited in what we provide in terms of clinic services. Really, we provide vaccinations and reproductive health services. That's not a lot, but if you're one of the clients who needs one of those services, it can be huge. So we hope to spread the word about our services by working more with community-based organizations, daycares, and schools as well, so letting them know about vaccination availability. You know, that's been challenging since COVID. Not everybody has kind of been on the vaccine bandwagon, so we want to rev that back up through social media, through direct outreach activities, and that type of thing. So that was definitely one of the things that we want to focus on. Not just with agencies, though, but also with individuals by doing more outreach events and that type of thing. In each of our planning units, and you noticed in everybody else's, we all pretty much included a CQI project. That is in all of the planning units here as well. Particularly in clinic, we always have room for improvement. So again, staff will identify CQI projects. One currently going on is digitizing our inventory process. So there are always lots of things for improvement, and so we continue to do that, and we'll continue that in the next planning period. Dental services, ensuring access to quality dental care for all by addressing systemic barriers through advocacy and outreach. Our dental director is extremely active with the Ohio Dental Association, which is amazing for us as a health department. I think it's really a feather in our cap. She serves as a chair of the, it's called the Medicaid Work Group. And so she's not just talking about, you know, dentistry for all, of course it's for all, but she's also really focused on making sure that there's a voice, lending a voice to those that don't have access. So she's out there promoting Medicaid fee increases if that's necessary. How do we get more dentists to come to the table so that we can serve more clients? That's a number one unmet need in our state, and she's very, very active, and so we consider that a huge asset in the dental department. So she's going to continue to work on that advocacy locally as well as at the state level. Improve efficiency of dental clinic operations by using technology. We have some ideas in terms of, which this would also be CQI, in terms of digitizing health history forms. We have possibly some equipment that we would like to utilize that is kind of cutting edge technology that would improve the efficiency of the dental unit itself. So those are the types of things that they're looking at in the dental program. Dental is paid for, which you probably know, mostly by general fund money, and we're grateful for that and in our community. But we want to make a concerted effort during the next strategic plan to really kind of look for sources of additional funding, whatever they might be, grant funding. We're going to kind of dig under rocks and see if we can bring in some extra funding so that we don't impact the general fund budget, but yet we can still move some of the things forward that we'd like to technology-wise. Communicable disease. This unit, the goal is to improve health outcomes by increasing public awareness. We have made great strides, particularly since COVID, in our communicable disease unit. Post-COVID, we had a lot of relationships that developed throughout the community because people were constantly engaged with us. That's been a benefit to us in the long term. So we want to continue to build on that, working with long-term care facilities, daycares, and schools. We convene a lot of regional meetings here in the communicable disease world. We convene meetings with the state, and we are really seen as really, quite frankly, a subject matter expert. We get referrals from all over the state. ODHs will call Summit County and ask them what they do. So we're very proud of that, but we want to continue that to share the knowledge that we have. We'll continue to do outreach as well, media campaigns, presentations, because we have grant funding that supports communicable disease programming as well, our HIV, STI programming. So we'll continue to work on that. This last goal, of course, we have a CQI project. I'm not going to say you know what that is by now. We've all talked about that, but we will also identify projects for CQI. The last one is fostering employee engagement and development. Our communicable disease unit is very, very young. I wouldn't say the average age, but most of the staff have even been nurses for just about 2 years. So they're very, very young, and we really want to provide lots of opportunities for them to get additional education. Many of them have developed, have gotten certifications within this past year, but we want to continue to build on that for succession planning. I tried to go as fast as I could.
Okay.
I know it's getting late.
Any questions?
Do you guys do a lot of referrals to the QHCs for the dental?
We do some. We certainly do some.
This seems like a logical partner to send them to.
Oh, absolutely.
All right. Last but not least, so the Family Health Division is, as you guys know, primarily grant funded. So when we talk about our priorities involving the strategic plan, most of our priorities lie within the community conditions modernization and then also evidence-based health. So we'll start with maternal child health first. And the first goal is to improve maternal and infant health outcomes and reduce disparities by strengthening access to and coordination of quality resources and services within the Full-Term First Birthday Network. So first of all, Full-Term First Birthday is a network of partners in Greater Akron/Summit County that focuses on infant vitality resources as a whole. And we, Summit County Public Health, are seen as the conveners of that. So overarching over the next couple of years, our intentions are to do a better alignment in advocating for funding to support evidence-based and community-informed strategies by increasing the number of funded partners in implementing proven interventions. And then along with that, a couple of partners have gotten together and we've identified that there really isn't a good alignment from pregnancy all the way up to kindergarten. So we're having conversations of how we can do a better job of implementing a coordinated service pathway from prenatal care all the way to childhood, and making sure there's a continuity of care and supportive services for both for mothers and fathers, because we don't have a lot of access for father figures in Summit County, as well as making sure they're tied to health outcomes. The second goal is improve the quality and effectiveness of home visiting services by identifying and addressing gaps in service delivery and ensuring consistent adherence to program standards. So we switched our home visiting program about 2 years ago at this point. We used to operate under a program called Nurse Family Partnership that was home visiting but functioned by nurses. We identified that in our community it wasn't something that was really working, so we switched back to a home visiting program called Healthy Families America. You might have seen that there's a lot of push from the governor's office around home visiting in that structure. So Healthy Families America is an accreditation, and there's a lot of program standards, and a lot of it is quality improvement based. So we are in the thick of getting to a point where we have to do fidelity assessments. We have various findings and improvement processes in order to get accredited. So we actually just completed the step one of many steps in order to get accredited, and we have to be accredited basically by the time the strategic plan is over. So that is what we're working on there. The next unit that we're going to talk about is senior and adult services. Improve caregiver capacity and confidence in supporting individuals with dementia by expanding access to evidence-based training and education programs. So what we've identified with this unit specifically, a lot of the grants that we currently have / had are really focusing on the overall program delivery and collaboration with partners. So the unit is going to partner with agencies to put into effect a program. It's called, the acronym is IDEA, but it focuses on identifying behavior, determining the cause, exploring strategies, and evaluating the aftermath of the situation. So it's really targeted on evidence-based interventions, and it's going to teach not only our staff, but also partners how to make sure that we're doing it and evaluating things in an evidence-based capacity. So we will be on the front line of that. We will be facilitating that, and we will be doing that in collaboration with a lot other senior and adult service partners in the community. The second one is improve operational efficiency and effectiveness within senior and adult services department by identifying and addressing process inefficiencies. Similar to everybody else, we're trying to make things better. Also, currently a lot of our grant funding is federal funding. So we're trying to make sure that we have consistencies across when we're writing grants, and also the deadlines are getting shorter and shorter. So we want to make sure that whenever we see something pop up, it instantly act on things. And also they're getting more demanding in terms of like, how are you truly evaluating that you're having an impact? So there's been a lot of work on how we're making sure that we actually have outcomes and what those outcomes look like. The next unit is social determinants of health. Strengthen community partnerships and reduce health disparities by implementing community-informed strategies that address social determinants of health along with priority populations. And with that, we are designing and implementing evidence-based and community co-design interventions that address health inequities along priority populations. And we have a lot of different populations that we focus on, obviously, which is intertwined across the entire unit. So obviously we focus on pregnant individuals, we are focusing on aging, we do some focusing on housing as well. So we're looking with our partners that we're working with to figure out how can we co-design some things and then evaluate them to figure out how we can one, increase community engagement, and then also make sure that whatever we're designing and creating is something that the community is in alignment with. And then also the hope is that we can take these things and apply for additional grant funding and additional grant dollars. Strengthen subcontractor relationships and accountability by using feedback and performance data to improve partnership and effectiveness. So you guys see every month, we have a lot of contracts, a lot of subcontracts. And what we realized through conversations is we don't really have a process to get feedback from subcontractors how we operate, because they are they're basically there's a customer service touch point there as well. So with that being said, we want to create a survey, basically talking about like how they feel about our interaction, how things are going, and obviously within our fiscal guidelines, not trying to take anything of that into consideration, but trying to create a way for us to figure out how we could be better stewards to them. We asked a lot of our subcontractors, but we never really asked them for feedback on how where our delivery is to them. So that is something that we do feel like will be helpful. And then also some TA support. So we have some of our contracts require us to work with grassroots organizations that don't have a lot of knowledge in larger grants or things like that. So it seems like our only touch point with them is negative. So how can we make sure that we have more positive interactions and we're helping them be better stewards so they can eventually hopefully get more funding from not just us. And then last but not least, we have WIC. Increase WIC, which is Women, Infants, and Children. Increase WIC program utilization by expanding community partners and improving referral pathways to each eligible population. So there's been a lot of conversations lately at the state level of lack of WIC utilization. What we're finding at the state level is we have a lot of individuals that are eligible for WIC, but not currently enrolled in WIC. So the state actually has implemented a program where each county is mandated to contact a list of individuals who are eligible for WIC but not on WIC. So we get a list every month that is very long, sometimes has 500 individuals on it, who are Medicaid eligible and have children that meet the qualities of the eligibility requirements for WIC, but they're not on. So there's a whole bunch of outreach engagement with that. So we feel that it's important for us to figure out additional outreach engagement tactics. We've done things with farmers markets and things of that nature. We do have some limitations because WIC still is not 100% internet-based yet. We still operate on some paper files, so hopefully that'll be changing soon. But we just want to be better stewards, and we want to make sure that we're doing the best that we can in our community to make sure people have access. So that is something that we're looking into. And then lastly, another QI project, improve the efficiency and effectiveness of WIC service delivery through the implementation of QI projects focused on clinic flow and participant experience. And one thing I will say that WIC has done an amazing job. We have 5 sites, and the way that those sites operate, although they're different, slightly different because of the flow of the locations and things of that nature, each staff member can go to every site and they know exactly what to do. You could get a call from their supervisor and say, hey, don't go to Fairway today, I need you to go to Grand, and they're able to do that at the drop of a dime. So they've done a really great job in making sure that there's continuous improvement. Also, they've done a really great job of doing as much as they can from our side to make things paperless. So our newest site that we opened is Akron Children's. We call that site our first site that is paperless, meaning we don't give out paper education anymore. We don't give, all of our stuff is done through either links, QR codes. If they don't have access to those things, then obviously we do paper. But we're doing as much as we can from an electronic point of view, because we're identifying that it's way more effective and people can go back to it if they need to. People lose paper. So continuously doing that, and also we try to do our best on a monthly basis. We do have WIC meetings. We always talk about QI, and we always ask our staff, how can we make our process better so that clinic flow can be better. So I think that's it.
Any questions? Okay.
I just want to, it's not Keith, I know where I got the name, Patrick Fisher.
Oh,
If he sends, you know.
he does belong to us.
So what? Hey, you'll claim him. Well, you should. They said Patrick Fisher of the Health Department has been amazing and has done everything he can, even with all the gray area.
Good.
At least someone we have in our corner. You know, 'cause a lot of people are just feeling helpless with that type of a problem in the city and
I'm gonna let him know that.
everything that's
That's
going on in
great
the
to hear.
city.
Maybe
So,
you could
yeah.
send that to her so she can share that.
Yeah, that's great.
Okay,
That's pretty
Yeah.
impressive.
okay.
I mean, we can't monitor all of it. If we get tagged in something, we'll see it, but
Yeah.
usually.
But just, so anyways, but it came from somebody in town.
Thank you.
So given it's a late hour, I just want to say we're very impressed by all of you and this strategic plan. I have never sat through this conversation. I don't know if this happens every year, but this is like, you guys really have thought
Did a
through
great
this
job.
really well. I looked at the time frame, Chris, and I see this is going to go for final board approval in October. But I think we should report out that we reviewed in detail with all of you this and
Mhm.
are impressed with what you've done and want to
I
move
agree.
it forward. Is that appropriate?
I agree, I
And
really.
who, are you the chair of this? Who runs this?
I am.
Dr. Cook is.
Oh, Dr. Cook. Sorry, Dr. Cook. I just can't believe there's room on Mount Rushmore. I see
Yeah,
it's
that was this morning.
very impressive. So if you will report that out at the next meeting, I'm
Yes.
very impressed.
Oh, I am totally
Yeah,
impressed.
so-
Kudos to every speaker.
Yeah, great job, you guys. This is a lot of work.
I'd like to say though, somebody sitting in the room that hasn't said much, it's Steve. And I mean, he really walked us through. He's never done this process before and it was really, I feel like it was pretty easy
The
for us.
second time around.
Yeah.
So, yeah, and you've definitely really helped everyone out and.
He met with us, he
Appreciate-
rewrote things
Yeah.
for us, so it was a great job.
It's very impressive.
He makes it very easy.
Do we have to report out that we approved what you're moving forward with or not? No.
Or is it just?
I would say that you were approving in general.
The process
Yeah.
and where you are in that
There
process.
may be a
Yeah.
slight change to where.
Oh, yeah. We know that. We know you're going to change it.
I assume they'll be reporting like red light, yellow, light, whatever, of how far you are through the process. And then I assume the two of you are gonna have a lot of crossover and screening people that were coming through the clinics, I would think.
Absolutely, absolutely.
And that's one of the things we do want to improve is the report out to the board.
Yeah.
We want to make sure that we're a little more transparent than I think we are presently. We provide the quarterly report outs. One was included in this month's
Mhm.
report. But we may look at other strategies to make sure that you can kind of see this moving through
Yeah.
the process.
You guys did a great job on this.
Yeah, and I think we should explain that. And Dr. Cook might be able to explain, you know, we spent a good hour kind of sorting through this and the history of this and what's happening.
Yeah, definitely.
So
Yeah.
it's impressive that everybody understands there's a lot of thought here. It's obvious, but it's hard sometimes for people to understand that. So that's,
Especially if you've not been through it yourself.
Right.
All right, any other business? Okay. That
Okay,
will
can I
conclude the
adjourn, can I adjourn the meeting at 7:32?
Yeah.
Bye, guys.
Okay.
Bye.
I had them post